Hello fellow students, I'm here today to talk to you about gonorrhea. I'm going to be explaining what gonorrhea is and how it affects the human body. Gonorrhea is a sexually transmitted disease involving inflammatory discharge from the urethra or the vagina. Gonorrhea is one of the most common diseases passed from one person to another during sexual activity. In men, it most often infects the urethra. In females, it usually infects the urethra or the cervix. It also can infect the anus, throat, and pelvic organs, and in rare cases, it can infect the eyes. What is known about the bacteria? Gonorrhea, also known as Neisseria gonorrhea or gonococci, is a diplococci bacteria. Diplococci is a globe-like shape in two pairs. These bacteria can grow on chocolate agar with carbon dioxide. It is naturally competent for DNA transformation as well as being capable of conjugation. Neisseria gonorrhea possesses a gram-negative outer membrane which has proteins, phospholipids, and liposaccharides. Neisseria gonorrhea is a fragile organism that is vulnerable to UV rays, temperature changes, and other environmental changes. Now I'll talk to you guys about the symptoms. In females, symptoms are usually resembled as a bladder or vaginal infection, or sometimes they are not even present, making it difficult to treat. Symptoms can appear within 2 to 5 days for males, but may not present in females for over 30 days. The following include painful urination and bloody or yellow vaginal or penile discharge, which, if left untreated, can develop into pelvic inflammatory disease for females and swollen and painful testicles in males. In men, you will have the following: a burning sensation while urinating, a white-yellow discharge from the penis, painful or swollen testicles. For females, you'll have the following: painful burning sensation while urinating, increased vaginal discharge, or vaginal bleeding. And for the rectum, it can be noticed by the following: discharge, anal itching, soreness, itching, or painful bowel movement. Now for the diagnosis. The presence of gonorrhea can be diagnosed using a gram stain test, which will turn pink for the gram-negative bacteria. If you want to see if you have the bacteria in your throat or your anus, a doctor will use swabs to collect samples. A genitalia examination by a doctor or nurse, or if you're a woman, you can have an internal examination. The general outlook for gonorrhea being deadly is that there has been no reports of anyone dying from this disease. In 2009, a particular strain of gonorrhea known as H041 was discovered in Japan by a 31-year-old female prostitute. Doctors said that H041 was resistant to the current antibiotics and was placed in the superbug category. Alan Christensen, a doctor of naturopathic medicine, said, "Having this strain can cause septic shock and death in a matter of days." The H041 has only been found in a 31-year-old female nowhere else. Due to Centers of Disease Control, they say gonorrhea is very common in North America and is the second most common disease. It is usually seen between the ages of 15 to 24 years of age. Since 1997, the rate of gonorrhea in Canada have been increasing. In 2012, there was an estimate of 10,000 cases of gonorrhea in Canada. Centers of Disease Control estimates that annually 820,000 people in the United States get gonorrhea. Centers of Disease Control says that 570,000 of them were among young people, 15 to 24. If you have gonorrhea, you are encouraged to go and get medication as soon as possible. The bacteria that causes gonorrhea have been resistant to many of the antibiotics that were very effective in the past. Small amounts of penicillin and later tetracycline was a standard treatment in the 1940s. As time went on, the use of penicillin and tetracycline used to treat uncomplicated gonorrhea become more and more resistant as new strands mutate. The Centers of Disease Control currently recommend the following: a single dose of ciprofloxacin and ofloxacin as a broad spectrum, fluoroquinolones and cephalosporins. Some common side effects of these medicines include nausea and vomiting, diarrhea, belly pain or cramps, vaginal itching or discharge. There's no effective vaccine to help with gonorrhea, but here's to prevent it. No form of sex is the best prevention. Using latex condoms from start to finish if you have oral, vaginal, or anal sex. Having sex with only one unaffected partner who only has sex with you. Have regular checkups if you are sexually active. If you have an STD, don't have sex until all partners have been treated. Careful consideration and open communication between partners may protect all partners involved from infection. Untreated gonorrhea can cause serious and permanent health issues in both men and female. In a female, if you're untreated, it can cause pelvic inflammatory disease. By having PDI, you'll have the following: pregnancy outside the womb, not being able to get pregnant, long-term pelvic abnormal pain, formation of scar tissue that blocks fallopian tubes. In men, gonorrhea can cause a painful in the tubes that are attached to the testicles. In rare cases, this may cause the male not to be able to give sperm to be a father. Rarely, untreated gonorrhea can also spread to your blood or joints. This condition can be life-threatening.
Created using Powtoon.